think that reflects many different things going on in cancer right now that have all sort of worked together to see these impressive reductions in mortality that have been going on really for decades. And last year was just the best year ever, but this has been a trend that's been going on since the early 1990s. So one important part of that is tobacco control. As fewer Americans are smoking combustible cigarettes, then fewer Americans are dying of lung cancer, and that is and other kinds of tobacco-associated cancers. That has a big impact on national cancer mortality numbers. But we also see the benefits of improved screening. For example, colonoscopy in colon cancer is quite effective, and mammography in breast cancer can be effective. So we see areas of screening that are working. There's cancer prevention, so vaccines for things like HPV and hepatitis B can reduce malignancies associated with those viral infections. So prevention, screening, early detection, tobacco control, and then also lastly therapy. We have new impressive medicines that are treating some patients with cancer and helping them live longer or even be cured of cancers that used to be uniformly fatal, such as melanoma and certain kinds of lung cancer. So a widespread set of activities, all of which reflect decades of basic science research that underpins this foundational understanding of cancer, are now translating into large benefit for the American public. It's really been a large number. So, it's almost for every kind of specific cancer, of which there are hundreds or thousands when you really define them on molecular biologic subtypes. Each of those is now getting its own therapy or therapies. But, as general classes, the class of immuno-oncology drugs that activate the immune system to help the patient fight its own cancer, have been very successful in things like melanoma and lung cancer. And those drugs are now getting widespread use and are often becoming the standard of care and replacing older modalities. Very exciting. We've also seen a lot of progress in these sort of small molecule so-called kinase inhibitors, these pills you can take every day, and they've been quite active for when matched to the right patient. When patients are molecularly defined and treated based on their, the molecular susceptibilities of the cancer, those sorts of drugs can be quite active as well. So lots of new things in therapy. One problem for us is figuring out how to combine them all. There's so many new treatments, plus the old treatments, some of which work. How to use them and in what order and in what combination is a very big challenge for the NCI. We think this could be a really important area. Tobacco control has been a successful story for the United States, but as good as it's been, I think it could still be better. We still have a lot of people using cigarettes in the United States, and we'd like to find ways to transition them away from combustible tobacco use. That causes a lot of lung cancer, head and neck cancer, bladder cancer. Many cancers are associated with tobacco use, and so more to do on tobacco control and nicotine addiction. Big important part. I think we can do better in terms of cancer screening in the general population. So we have certain kinds of screening that we know work, like lung cancer screening using chest CT, that are not widely used. And so we need to educate the community of physicians on how to use those screening modalities better and get them disseminated out in the community. Making sure that the uptake of things that are proven, like mammography and colon cancer in specific populations, colonoscopy rather, that those things are done as they should be done. And that's a challenge, but an area where we have a lot of work. Getting vaccinations out into the community. We believe that we can eliminate cervical cancer in the United States between control and screening in decades to come, but that's going to take some work at the community level to get to that done. So, cancer control and cancer screening are really some of the most important things we do at the NCI, and tremendous opportunity for the American public. It's been a strong support for the National Cancer Institute the last few years. I think appropriators really understand the time is now for cancer research. So this is a very special opportunity where we have this new biomedical research effort and this new understanding of cancer biology, and it's really starting to pay off for patients. And so they're supporting us. They see this as a good use of federal funds, and the support for cancer has been quite strong. I have always felt, as NCI director, great support from the administration and great support for Congress for what I'm trying to do.